You'll want to keep that phone handy, keep that number handy, because Dr. Regan Ackerman is joining us here in studio from Freedom Mini Dental Implants. You will be taking calls in our second segment, answering questions from everybody, and people always have a lot that they want to ask, and you're full of knowledge when it comes to this stuff.
Yeah. So with those mini dental implants, it's some people aren't as familiar with the mini dental implant, used to the kind of the more surgical, bigger diameter implant. So there's always lots of questions about how the mini implant works. It's just a less invasive, smaller diameter implant. Help tons of people, especially struggling with dentures, get rid of denture glue or just replace a single tooth. There are so many ways I can use the mini dental implants.
As we're talking about that, you always bring great models with you to actually show what mini means, what it would be like to go through that procedure if it's something that you've been needing for a while. Let's start with one of the ones you have here to really show the difference and what mini is.
Yeah, definitely. So one of the most common things I do is what we call a snap-in denture. So many people struggle with dentures. They're using tons of denture glue, especially the bottom one. It never stays in, it moves, it flops. People give up on it. They don't ever wear their lower denture. So that's where a mini implant can come and save the day. So the mini implant is just a smaller diameter implant. So when I place these, I just numb you up with local anesthetic. I'm not making any incisions or stitches. It's a lot less invasive than the bigger implants. The other great thing about the mini implant, the day I place the implants, you don't have to wait another 3 to 6 months to use these implants. The same day I place the implants, I put these attachments inside your denture, and then you can leave that day with the denture snapped on to the implants. So then you no longer have to use denture glue. You can eat better. You've got that confidence to know your denture is going to stay in. You'll wear your denture pretty much 24/7, but you'll just snap it out once a day, rinse and clean it, and snap it back in. So that's a great advantage of the mini implant, especially people that have been told, maybe you've had dentures for a long time and you were told you don't have enough bone to do implants. You may have enough bone to do a mini implant, because I don't have to have as much bone. I just need some bone, and I'll show this model real quick, because I think that really speaks volumes of kind of the difference. When I place a mini implant, this is you can barely even see it because it's so small. That's the little pilot hole essentially I make when I place an implant. A lot less invasive than the big surgical one, okay? So this is the little hole I have to make. So you can see, we always say, I just need some bone. I don't have to have a lot of bone. So I don't have to do bone grafting and sinus lifts, or if you were told maybe you weren't a candidate for an implant before, you might be able to be a candidate for the mini implant and be able to replace that single tooth, or be able to get a snap-in denture, or get rid of the denture completely, because I don't have to have as much bone. It's just a much less invasive procedure.
That's always one of my favorite parts, when you show how small the minimally invasive the hole there is on the model compared to the one that you're used to, because it tells a story, especially if you can barely see it there on the monitor.
Definitely. And I know it's still dental work, so a lot of patients are still nervous.
Sure.
But usually once I get, the patient numb, and I'll make that one little pilot hole and place an implant, I'm like, okay, we've got one implant in. And they're like,
wait, already?
Really? You snuck one in? And I'm like, yeah, that's it. And then you can just kind of feel the sigh of relief. I'm like, okay, I got this.
Yeah.
This is easy.
I'm ready for the rest of the procedure. Speaking of one of those patients, I know we've got a before and after that we want to talk about today. Let's take a look and walk us through the procedure. And this is Lois, you said?
This is Miss Lois. Yes, such a sweetheart. So she came in and she had had an upper denture for about 20 years, struggled with a lower denture for about 5 years, and she knew she was just done with it. Like, she hated all the glue.
It was too much.
She couldn't wear the lower one very much. Her upper denture had broken, and so that before picture, she actually has her upper denture in, and you just can't really see her teeth
at all. You can't barely tell.
Yeah. So we made new dentures for her, and then we did the snap-in dentures for her. And obviously you can see all smiles now, so she doesn't have to use any glue with her dentures. She can eat better. She was so excited when she came in for her post-ops on how much more she could eat, and just having that confidence to know her dentures are going to stay in, and she can, order what she wants in the restaurant. She can smile now, and even with the new dentures, now she has a smile and you can see her teeth.
Miss Lois's smile there does tell the story, but I can't imagine, you said she, had about 2 decades decades that she was fighting with the old dentures and the old way that she was doing things. I can't imagine what it's like to go from that for so long to something that is so much easier and gives you that new freedom that she'd been after for a long time.
Changes your life for sure. Yeah, and that's why I'm here doing what we're doing on TV, because a lot of people, 20 years ago, either this wasn't an option, their dentist didn't do it, they didn't know about it. So that's why I'm here, just informing everybody of the mini implant, that it is an option, because there's a lot of people that have had dentures for 10, 20 plus years, and this could still be an option and get you in a better position to be able to eat food and taste food again and order whatever you want off the menu again at a restaurant.
It's so exciting when there's new technological advances and surgical procedures and things that we make headway on in the medical field, and arming yourself with that information is the first step. And so, of course, you're going to be taking questions after the break. Before we go to break, give people who are out there who maybe have some questions or thinking about calling in the types of things that you're going to be able to answer here in our next segment.
Yeah, I mean, any questions you have about dentures, a lot of times we can use the same denture, or any about the process. I will say, the consultation is free. All you have to do is call the office. There's no charge for the consultation. It includes a 3D x-ray, because I want the information to make sure you do have enough bone and you are a candidate. So please, if this is something that interests you, please call and make the consultation. It's no charge. You'll see me. I'm the only dentist there. I think that's important to know too. We're a small family-owned business. We're not corporate. I'm the only dentist. I will be the one doing your consultation, doing the procedure, everything start to finish.
That's such a comforting feeling too, knowing that the person that you're going to interact with is the person that you see right here today.
Certainly.
All right, stay with us here on Wave Listens Live. We have more from Dr. Regan Ackerman after the break. She's going to be taking your calls, so make sure to get those phones out. The number again, 502-571-5263. She can answer all those questions you may be having about your dentures. See you in just a couple minutes. We are back with you now on Wave Listens Live. Brian Schlonsky, joined by Dr. Regan Ackerman of Freedom Mini Dental Implants, sharing all that great advice for you. Maybe you need some dental work done. She's got the answers. And right now we are taking your calls. If you have a specific question you'd like to ask of Dr. Ackerman, we're going to do that now. If you have a question that is about cost and some of the numbers issues, you can call into the office. That's the best place to run down the list there. But she's here today to answer questions about the procedures and anything else you may have. And our first caller is on the line now. We have Patty with us. Hey, Patty.
Hello?
Can you hear us here? It's Brian and Dr. Regan Ackerman.
Yes.
You could go ahead and ask the doctor your question now if you'd like.
Yeah. What do you do with receding gum line? And if you're on blood thinners, is this a less invasive thing to have done?
Yeah, so two great questions. So as far as the blood thinners go, usually I do not even have to take you off your blood thinner, because it is exactly what you said, a lot less invasive procedure. I'm not doing any incisions or stitches, so I don't really even have to take you off blood thinners like they do, for a extraction or a surgical implant. So that's one of the big benefits of the mini implant, being less invasive. And then as far as receding gum line, a lot of people do have to have teeth taken out or removed because of gum recession or bone loss around their teeth. We can still do, a denture or a crown or bridge, even if you lost your tooth because of gum recession. And there's ways to still make it look aesthetic. And we'll go over that at the consult, show you models and things like that. If we have to add a little, what we call, pink porcelain or something to make it aesthetic, but there's definitely ways to work around that for sure. So yeah, two great questions.
Yeah, Patty, getting us started there. And I think you touched on something so important there, because it's minimally invasive. I imagine that the time that you take to recover from this and the things that people typically deal with big surgeries like infection risk, all that goes way down.
Right, yeah. And so usually, for a denture stabilization case, usually that first night might be a little achy, but I've had patients go back to work the next day, no issues, or even a single implant. A lot less invasive, so a lot less downtime. You're not gonna, no stitches, you're not gonna be swollen. So definitely that is a huge advantage of the mini implant is, a lot less downtime.
It's so great to hear, especially for people with busy lives. All right, we have Elizabeth on the line now. Hey, Elizabeth, the doctor's ready to take your question.
Hello.
Hi.
Hello.
Yeah, can you hear us?
I can hear you.
All right. What's your question?
Okay. I was wondering, I have dentures already. Now, with these implants, is it still going to have that big piece across the roof of my mouth, like with dentures?
Yep, so great question. So if you have good bone and you're a candidate for the implants, usually once I place the implants, I can trim some of that off of the roof of your mouth and help with that gaggy feel and help, so you can taste your food again. I meant to show it when I showed that model, but that one was trimmed back. So I can trim some of that denture off the roof of your mouth so you can, not gag as much and be able to taste your food again. And there is another option, I'm sure we'll get to it later in the segment, where you get rid of the denture completely. We kind of cement like a permanent bridge onto the implants, and then you really have nothing on the roof of your mouth. So definitely a good question, but that is one thing we can do with the snap-in dentures, be able to trim it back a little bit, because that's a big reason people hate that top denture. So yeah, and if you have dentures, like you said you do currently, if you like them and they're in good condition, sometimes I can use your dentures as long as you like the way they look and everything's good, and we can convert those to a snap-in denture and save money that way as well.
Yeah, it's great information, and I think as we wait for more callers, of course, we're taking your questions, 502-571-5263. While we wait for other callers on the line, let's go to the models again and talk about what you were just talking about. The permanent teeth is another great option for folks out there.
100%, yeah, because this is definitely the nicest thing we do. People love this because you get rid of the denture completely. So as far as the process goes, and just kind of backing up to talk about how less invasive it is, because I'm not doing IV sedation, I'm not putting you to sleep, because it's minimally invasive. I will numb you up, just local anesthetic. So all my patients, they can drive themselves to their appointment and drive themselves home. So you don't have to have somebody drive you either. So when I place these for the permanent teeth, same process, no incisions or stitches, just going to place more implants, kind of depending on the size of your mouth and bone. And then since we have more implants, we're able to make just a bridge of teeth. So you get rid of the denture completely. And then this gets cemented permanently onto those implants. But then, like she was asking, you have nothing on the roof of your mouth anymore. You get to taste all your food again. You don't have anything back there gagging you. And this is cemented on. So you're gonna brush it just like regular teeth. It feels the closest to your natural teeth. And then we give you a water pick just to kind of keep the edges clean, and you'll get it cleaned every 6 months, just like regular teeth. But this is the permanent teeth option where you get rid of the denture completely. So, everybody always wants to throw those dentures away if they can.
And that's one way to do it. Well, a lot of great options here. We've got another segment still, so you can still answer more questions. If you have more questions, again, 502-571-5263. Also, when we come back from the break, we're going to show you another model. This time, maybe single teeth is an issue, maybe an accident, something like that, caused just a few of your teeth. That's something we can help with as well. Stay with us here on Wave Listens Live. We are back here on Wave Listens Live. Freedom Mini Dental Implants and Dr. Regan Ackerman joining us in studio and taking your calls throughout the segments today. We want to go to Doretta now, who has called in and has a question for Dr. Ackerman. Hey, Doretta, can you hear us?
I can hear you, yes.
Hello.
Hello. My question for you is, my husband has implant in the bottom. However, it's beginning now to jiggle and wiggle. And can you repair something like that, or do you have to take that out and put something new in, or?
Yeah, so if it's the actual implant part, like the screw part, then the chances are the bone around that implant has, you know, kind of, the quality's just not good and it may have to be removed. So if you can still go back to the dentist or whoever placed that implant, that would probably be ideal, because depending, if it's not a mini implant, you know, I say implants are kind of like cars. They're, you know, you go to the Ford dealership and the Chevy dealership, and they're going to have the parts and the pieces to be able to remove that specific implant. Now, you know, just because that implant has to be removed, if he's had it for a long time, it, you know, may be able to be healed up and be able to place another one, or there may be other options as well. You know, if you're talking about the implant part, the screw part. Now, if it's a tooth or a denture attached to it, and it may just be the tooth part that's loose, or the denture is just not attaching right, then there may be ways to fix that and not have to remove the actual implant, the actual screw part. So without seeing, it's kind of hard to know, but probably if you can go back to the dentist that placed it, that's probably going to be the best place to start right now.
Yeah, the car dealership analogy is such a good one, because it really it paints the picture of the easiest way to take care of some of these problems. All right, we have Howard on the line joining us now as well. Hey, Howard, we're ready for your question.
Okay, doctor. I'd like to get top and bottom dentures, implants, but the bottom teeth is all broke off, and part of the tooth is still in my gum, and the top part is broke off. They're really terrible. Roughly how much would it cost me to get the top and bottom?
So it's hard to do cost without looking at you to see how many, you know, teeth you have and what procedure, and so that's where the consult really comes in, because I'll take that x-ray, give you, you know, we'll go over the process and the models and what your options are and the different cost. So that's really where the consult comes in. But I can say usually the mini implants, you know, the treatment plans I've seen of patients I've come in, you know, with the more surgical treatment plans, usually we're about a third to half the cost. So it is a little bit more affordable too. And yeah, and it sounds like you need some teeth taken out, so there is a chance we may refer you to an oral surgeon for that. But I always say you'll never not be without teeth, so there's ways we will make dentures or temporaries for you while you go through the healing process. But as far as to be able to answer specific cost, that's where the consult would come in, and it's no charge. You just, you know, call and make the appointment, and we can certainly go over that with you.
Yeah, that's such a great option that you're able to do that consult and get some of these questions asked there in person as well, where you can see up close and personal what people need. One of the options that sometimes people need, we referred to this before the break, is maybe just single teeth or a few. It might not be a whole redo of the top or bottom.
Definitely.
You have a model for that too.
Yeah. So I know we've talked a lot about, you know, full mouth, but like you said, a lot of people, you know, may have had a sports injury, or some people genetically are born without a front tooth, and you may have what's known as a flipper or a partial, and they're miserable. Nobody likes to wear them. If you have one, you know. So certainly you can get rid of that flipper or partial and replace just a single tooth. Same thing, gonna place the implant same way, no incisions and stitches. The day I put the implant in, you will leave with a temporary crown on there. So you will get rid of that flipper or that partial or just that gap that you had the same day we place the implant. And then about 4 to 5 weeks later, we'll have the nice pretty tooth, and that will get cemented on permanently onto the implant. So it doesn't come in and out. We can do one tooth, or I do a lot of back teeth. We call them your molars, your big chewers, so that people can chew steak again and be able to chew food again. But it could be 2 or 3 teeth, kind of like these are. We're just going to place more implants, have a bridge made. It gets cemented permanently onto those implants, so it doesn't come in and out. But then if you had a partial, you lose that big bulky partial, you get to chew again. It's kind of like, you know, closest thing to getting your natural teeth back.
Such a great option for people, like you mentioned, maybe have a sports injury or a car accident or something and just need a little done. It's still a great way to get it done. We've got more questions for you as well.
All right, great.
You're a wealth of information today. Mike is on the line now. Hey, Mike, we're ready for your question.
Yes, sir. Yes, ma'am. I was calling to find out the exactly same question that you just answered. So.
What was your question, though? Ask it again.
Well, I have other implants in my upper teeth and in my lower other implants, but I do have I guess you call it a flipper in a bridge.
Yes.
On my front tooth.
Okay.
And I only need one done.
Yep.
So my question was, can you do the one? I think you just answered it just
Yes,
as I
and
was
we
on
can.
hold.
But you hate that flipper, right? Like everybody, you can't eat with it. Nobody likes it, right? So yes, I can do.
Well, I think it's the bridge. The bridge, if it comes off, I have to go back in and get another temporary. And instead of doing that, it might be best if I just came in and seen you and to have you just go ahead and put a permanent tooth to fill in that space.
Yes, yeah.
Now, will that come back off though after you do the permanent? Will that come back unglued? Will I continue like 2-3 years from now have to have it glued back in?
Yeah, no, ideally no. Once we place the implants and kind of cement the crown, the tooth onto that implant, you should not be going back and forth to have it cemented on. No, not like you're having issues with the bridge. So yeah.
Great information. That's why it's so important to do the consultation. We've got about 15 seconds left. Let's hit where to go and how to get all that booked if you need it.
Yep. So we've got 2 locations. One is on Dixie Highway in Valley Station, and one is on Bardstown Road in the Fern Creek area. So just give us a call or go to freedomimplants.com, and all the information's there as well.
It's always so great to have you.
Thank
you had so many great answers to questions today. More people calling, so we'll have you back on here soon. Have a great day, everyone.